Hi, Ms. Jordan. How are things going?
Very well. I took your advice and stayed on the medication, and I definitely notice a big difference now.
That's wonderful. Are you having any side effects from the medication?
Well, I definitely have some dry mouth. I have the lemon drops that you recommended, and it does help. I can definitely hold it longer, but when I do get that urge, I still know that if I don't get to a bathroom, I might have an accident. Is that normal?
Absolutely. The medication should allow your bladder to hold more urine, but you can't ignore your bladder when you get a strong urge to urinate. Some women do well with a few quick, strong Kegel contractions when they get that urge. We call them quick flicks.
Okay, I'm doing the Kegels regularly, but I'll try that trick when I get the urgency. Are there any other side effects I should look for?
Yes, there are. The most common side effects are dry mouth and constipation, but you can also get dry eyes, headaches, tiredness.
Okay, I have dry mouth, but it's not bad enough that I want to stop the medication.
So besides the sudden urgency that you're sometimes experiencing, are you satisfied with the improvement that you've seen in your overactive bladder symptoms?
I think at this point I'm okay, but if I do need more treatment in the future, what else would you recommend?
I think I mentioned that there are several other medications we can try. Some work better than others for some patients, so at times it's a little like trial and error before we find the one that works best for you.
I read in a magazine that they're using Botox to treat overactive bladder. Is that something that might be appropriate for me?
Yeah, that's a possibility if the anticholinergic medications don't work for you or you can't tolerate the anticholinergic medications. I usually do the Botox injections right here in the office during a procedure called cystoscopy. So I put a lighted telescope in the bladder and inject the Botox into the muscle of the bladder.
Does it hurt?
The nurses put a numbing gel into the bladder through a catheter and it numbs up the bladder before we do the procedure.
How well does that work?
Well, some patients who did not respond to or did not tolerate the anticholinergic medications do see a reduction in their overactive bladder symptoms after Botox injection, but the beneficial effects tend to wear off after several months. So we usually need to repeat the injections sometimes after 3 months, but sometimes longer, like 6 months.
Are there any risks from that treatment?
Yes, there are several potential risks like urinary tract infections. Also, about 6% of women without diabetes and 12% of women with diabetes get urinary retention, a condition where they're not able to empty their bladder adequately. If that happens, we would need to teach you how to perform self-catheterization until the condition improves, like when the Botox wears off.
You may not have to wear a bag?
No, my nurses would teach you how to use a small catheter a few times a day to empty your bladder, and that way you wouldn't need a bag.
That sounds difficult.
It might seem a bit awkward at first, but we can teach almost anyone how to perform self-catheterization.
Are there other treatment options?
Well, there is another approach to managing overactive bladder if medication has not worked or is not tolerated. That involves electrical stimulation of the nerves that control your bladder.
So, how is that done?
There are two ways today that we are doing this. One is called sacral nerve stimulation. It's a pacemaker device that gets inserted with a small surgical procedure into your upper buttock, and it connects to a wire that stimulates the nerves that control bladder function. It works for some women, but not everyone. So we can do a test stimulation before we do the implant to see if it will work with the pacemaker battery.
That sounds like real surgery.
Not really. I usually do the test stimulation right here in the office. I insert 2 small wires under local anesthesia into your lower back, and these 2 wires come out of the skin and are attached to a small device that looks like a cell phone, which has a battery inside that sends signals to the bladder. You then leave the office and wear the temporary device for a week so we can see if it is working to control your urgency and frequency. If you do have a good response to the test, then we schedule the procedure in the operating room where we place the pacemaker in the buttocks. But even that procedure is done under local anesthesia with some, sedation, sort of like when you go to get a colonoscopy.
Very interesting. That's a definite possibility.
Well, I can give you some brochures on the procedure so you can learn more about it.
Thanks. And what was the other way you said you could do the electrical stimulation?
Well, it's called percutaneous nerve stimulation. You'd come to my office once a week for 12 weeks and have a tiny needle, like an acupuncture needle, inserted into the ankle, and we can send an electrical signal to the bladder, similar to the sacral nerve stimulation, but only 30 minutes once a week for those 12 weeks. I'll give you brochures about both of those treatments.
Thanks. I had no idea there were so many options for treating this condition.
Well, it's really been in the last several years that some of these newer treatments have become popular, but we really have a lot of options for treating this condition. We can successfully treat most women with this condition.
Well, you've really given me a lot of hope. I didn't think this was a common problem, and I didn't know that there was anything that could be done about it.
You certainly aren't alone. Overactive bladder symptoms have been reported at least sometimes in the past 4 weeks by about 1 in 3 adults age 40 and older in the U.S. People just don't talk about it that much because many people find it embarrassing.
I know that's why I waited so long. Honestly, I was ashamed and embarrassed, but I'm so glad that I mentioned it to Dr. Edmonds, and I'm so glad she referred me to you.
I'm glad she did too. Why don't you read through the brochures and let's follow up in a few months to see how you're doing on the medication. If we want to make any changes in your treatment, we can talk about it then.
Thank you, Doctor.
My pleasure. I'll contact Dr. Edmonds and let her know how you're doing.
Thank you.